what not to say if you want to be taken seriously. Okay, you sit down, the doctor walks in and asks you, what brings you in today? And before you even explain what's wrong, you hear yourself saying something like, it's probably nothing. Maybe I'm overreacting. I know you're busy. And I want you to know something. These things sound like polite to say, reasonable to say, even kind. But sometimes these sentences, they do something you never intended them to do. They teach the room not to take your symptoms as seriously as you do. They're serious enough that you made an appointment and came in. Today, I want to talk about the phrases many women use without realizing it and what to say instead, because the goal isn't that you're dramatic. The goal is that you're clear and you communicate what it is that's bothering you. My name is Milca, and if you've ever walked out of an appointment thinking, why didn't I say that better? You're not alone. I've had women describe symptoms that was significantly affecting their lives and then spend the next 5 minutes of the appointment minimizing the symptoms. Not because they weren't important, because we've been taught to be agreeable as women, to be easy, to not make a fuss. But the doctor's office is one place where clarity matters more than comfort. Let's talk about how you communicate your symptoms in a way that helps you get the answers you're looking for, or at least better answers. Before we get into the phrases, I want to explain something important. Most women aren't minimizing their symptoms intentionally. They're trying to be considerate. They're trying not to be dramatic. They're trying not to waste anybody's time. Most women, it's been reinforced for years. You're strong. Oh, you're handling a lot. Oh, it's probably just stress. Take some time off. So by the time you walk into the appointment, you've already spent months convincing yourself, tolerating something that deserves attention. The result? You bring in the evidence, then you talk yourself out of your own evidence. And that's the habit we're going to break today. So instead of using the phrases, I'm probably just stressed, it's probably nothing. Try something like, I'm not sure what's causing this, but it's affecting my daily life. Notice the difference? The first sentence dismisses your symptoms before anybody even evaluates it. The second sentence stays factual. You don't need to diagnose yourself. You don't need to prove anything. You only need to accurately describe what's happening. Instead of, maybe I'm overreacting, try, this has been concerning enough that I felt it needed medical attention. If you made the appointment, if you took time off work, if you've been thinking about this for weeks, you're probably not overreacting. And even if the outcome turns out to be something minor, that doesn't mean the concern wasn't legitimate. Medical evaluation exists precisely because patients don't always know what's serious and what's not. It's not your job. Your job is to report the symptom that's bothering you. Instead of, oh, I'm probably just getting older, try, I'd like to understand whether this change is expected or whether it deserves further evaluation. Aging explains some of the things, but too often women are taught to use age as a catch-all phrase, explanation for all symptoms that deserve a closer look. Fatigue, insomnia, palpitations, brain fog, weight changes, joint pains, mood shifts. Don't assume. Ask. Instead of, I know you're really busy, try, there are a few things I'd like to make sure we cover today. I know this one sounds harmless, but watch what happens. Many women begin appointments by apologizing for existing. apologizing for taking time, apologizing for asking questions, apologizing for needing care. You don't need to do that. You are not interrupting the healthcare system. You are the reason the healthcare system exists to begin with. Instead of maybe it's just all stress, try stress may be part of this, but I would like to understand whether anything else could be contributing. This is a big one because stress affects nearly everything, but stress should not be the beginning of a conversation, not the end of one either. Sometimes stress is the explanation, sometimes it isn't. The point is to investigate, not assume it's stress. The real problem also isn't the phrases, to be honest. It's what they reveal. When women walk into appointments assuming they need to earn credibility, they believe they have to prove they're not being dramatic, prove they're not exaggerating, prove they're not wasting anybody's time. But credibility doesn't come from minimizing yourself. It comes from being specific and being clear and being prepared. And you don't need to make your symptoms sound worse than they are, but you need to make them sound smaller? Not really. It's not helping you to do that. I want you to hear this. Your symptoms does not become real only because someone else agrees with it. It is real because you are experiencing it. Your exhaustion is real. Your insomnia is real. Your brain fog is real. Your anxiety is real. The weight gain, the weight changes is real. Your experience matters before the diagnosis arrives. Never forget that. Because women spend far too much time asking for permission to trust themselves, and far too little time recognizing their own body has been telling them the truth all along. Before your next appointment, pay attention to how you speak about your symptoms. Listen for the apology. Listen for the minimization. Listen for the moment you start shrinking and replace it with clarity. If you'd like help doing that, I have created a doctor's confidence visit kit that includes symptom organizers, questions prompt, and appointment preparation tools designed specifically for women who want to walk into appointments feeling confident and prepared. The link is below in this video. And if you know someone who constantly says, it's probably nothing, send her this video, because sometimes the first person who needs to take her symptoms seriously is her. See you in the next video.